Today I'm talking to Professor Miguel Jorge. Miguel is professor for psychiatry at the Federal University of Sao Paulo in Brazil, and he is the president of the World Medical Association. Miguel, we are all now under the impression of the pandemic. The infection has spread over the globe. What is happening to us psychologically?
Good day, Otmar. I think at the first moment we are just listening and watching through the TV what is happening in other countries, and then the pandemic come to our country and come close to us. Usually, the first reaction that people shows is a kind of shock with the situation and even some denial, considering that, well, this will not happen to me, this will not happen to the people who are close to me. But, I think in a very fast way, they realize that this is not true. Situation gets a little bit worse in the beginning, and then people start reacting with some sadness, start to experience a feeling of impotence in front of what is happening, and then they receive a message from the health authorities that we have to be social distant from others and be confined at home. Actually, I think the term would be more correct if it was physically distant from others, not socially distant from others, because even being confined at home, we can be and stay plugged, we can stay connected to the outside world through different ways of communication. So I think at this stage, people need to be prepared for a long stay at home, days in a row, maybe weeks. So some measures needs to be adopted by everybody. We have to have a kind of routine established at home. We have to try to keep our daily activities as far as possible. And we have to deal with the situation, creating new ways of being for so long time at home. So it's very important that people keep a healthy lifestyle at home, with a proper diet, not abusing of carbohydrates, keeping physical exercise, have a sleep pattern that would provide rest to them, and avoid the use of tobacco, alcohol, or any other drugs as a way to deal with bad emotions that will arise as times comes at home. And the most important thing is to keep our social contacts, particularly with our family members and our friends, who are the most important people in our lives. So I think it's the most important thing to do, to be confined, but not isolated from the outside world, from the other people who are not with us at home. So I think this is the first stage of this situation when they reach us in our countries.
Now, some of our patients have to be hospitalized, some even go in intensive treatment. Um, for the normal people, it's sometimes already difficult to keep their social contacts going and living, and to keep a routine. But this is, of course, is basically impossible with those being hospitalized, especially then when hospitals don't allow visitors, don't allow outside contact.
This is a very difficult situation. No, I believe that is compared to some kind of war environment. No, in regular situations, it's in many hospitals in Brazil, where I live, and everywhere in the world, the fact of being in an intensive care unit by itself is not something that needs to be a total isolation from the world. You know, some of our ICU here in hospitals have even an extra seat for a family to stay 24 hours a day with the patient. But when the situation is related to an infectious disease, as the coronavirus, you know, and with all this pandemic that we are experiencing, unfortunately, I know that the measures that hospitals needs to taken is much more strict to keep, you know, biosecurity of everybody, not just the patient, but their family and also the, you know, health team who is working in the hospitals. Unfortunately, the people who will be hospitalized due to this COVID-19 disease probably is people who will be seriously affected by the virus, experience, you know, respiratory problems. Sometimes they will be intubated in the ICU. So, you know, the contact with families, friends, or even with the health professionals who are working there are very limited. Mm-hmm. So it's a very difficult situation to deal in terms of, you know, any kind of emotional support. But I would remember to the staff who work with these people that sometimes, you know, just touching the patient, you know, holding their hands, you know, sometimes we'll give them something in that, you know, so difficult situation that they experience if they are, you know, in an ICU in a hospital. My message to our colleagues, our physicians, and also to other health professionals is not to, you know, forget that they have someone in front of them who are, you know, risking to lose their lives, but they will probably experience fears of dying. And then any kind of, you know, any gesture, any attitude that could be a kind of emotional support to them will be very, very, very important.
Coming back to our normal people living in isolation or in distancing, do we have to expect more domestic violence, violence in families, violence against children or women in that situation? Is that something that produces a stress which finally results in those acts of violence and misbehavior?
I am afraid that yes. No, I think if this isolation, this confinement at home extends, you know, for a long period of time, you know, tensions will arise. It's normal. No, people need to be prepared to face tensions. You know, they need to know that this will happen. So they need to be prepared to deal with tensions inside home. It's very important that people try to build an alliance with other people they live together. You know, they have to be very attentive to children. Children will be very much more stressed than adults because they do not have, you know, the ways and the maturity adults have to deal with a crisis. And then, you know, we have to be very supportive and give extra time to them to be kind with children, but also to our partners and to our family members all together. And this needs to be expressed. If we talk about that, we gain, you know, a chance to deal because if we just behave according to what we are experience and we not talk about, the danger of the risk of arising situations, particularly of, severe irritability that can go to even to some kind of violence, is something that needs to be taken into account. I am very much concerned, Otmar, with people that, do not have good uh, good conditions at home. Our world is a very unequal world. Some of us are privileged people, but in the slums in Brazil, as everywhere in the world, as even in the rich world, the outskirts of the cities, we have, sometimes in 10 square meters space, 6, 8, 10 people living together. So we have to be at this moment very much concerned about that and try to see, can I can I have something to do for those people? Is it possible that I can do something for them? We are seeing some movements of donations to give these people, at least a box of basic food for their everyday, because many of them are losing, the way as they have to be at home to go out and earn some money. They do not have regular jobs as much of us have. So I think it's important also, try to see how can I help those people. I cannot go out, but there are people, collecting donations, buying food, and take food to those people. And even, not just food, but make soap, and things that they need for their daily lives. So violence in this situation is much more likely to happen because of, the small space that those people will be confined. So you are right. We have to take into account that irritability will happen, anger will arise, and even violence is something that can, increase in if the isolation and confinement extends for a long period of time.
Thank you very much, Miguel. I hope we all get through this, hopefully with low violence and not that bad experiences. But I think we will learn more as we go through this period of isolation and distancing. Thank you very much for the talk.
I would like what before ending this. First of all, to thank all physicians of the world for the work they are doing. Also to our colleagues that work in the healthcare of people, and I can tell to the population, to just regular people who are listening and watching to this, that you can count on us. Our profession is to help you in your everyday needs. Thank you very much, and we will be out of this situation in few months much stronger than we are now. Thank you. Thank you.
Thank you very much, Miguel. Bye bye now.
Bye.